I'm Dr. Walters, the Chief of Anesthesia here at Kaweah Hospital. Put my hat on. Let me show you around. Here is my hospital, Kaweah Hospital. This is our old unit right here, and this is what we're most proud of, which is our new unit, also known as the Kaweah wing. In the Kaweah wing, we house cardiothoracics, vascular surgery, and we have labor and delivery. We also have plans to expand the next 2 floors. Hopefully that'll be done in the next couple of years. Come on back. We've been here 16 years. Visalia Anesthesia Medical Associates, that's it. We were formed specifically to take care of the hospital. We have one client, which is the district. Let me show you my office. This is our office. Quaint, gets the job done. This is my secretary, Maddie. She does most of my coordinating. Some of the various policies and awards that we received here. Our board. I'm going to go in the back, change scrubs and freshen up, and then we'll get back for our next part. Thank you.
Hi, I'm Dr. Andre Edmonds. I'm an orthopedic surgeon here at Kaweah Delta.
How long have you known this anesthesia group?
The anesthesia group I've known since 2006 when I moved to Visalia.
What services have they provided for you?
Basically anesthesia, everything I want they provided. They provide just general anesthesia, spinal anesthetics, blocks, some pain management, just about everything I need they're able to provide to me and my patients.
What are your general feelings about the quality of their work?
Excellent, excellent, excellent. I've worked different places before. In fact, I also worked at a trauma center for 22 years in Illinois, and anesthesia is excellent. I can count on them, and I don't have to worry about safety issues with my patients. I can bring the sickest and the toughest case here, and I know that will be done very well.
Hello, hi, my name is Dr. Han-Soo Kim. I'm one of the general surgeons here at Kaweah Delta Surgery Department, and been working here for about 6 years. And
how long have you known this anesthesia group?
I've been here for 6 years, so I would say 6 years. I've been working with them.
What services have they provided for you?
Well, they provide all the anesthesia for my patients, inpatient, outpatient surgery here at the hospital, and for emergency cases at nighttime, and so on.
What are your general feelings about the quality of their work?
Well, so far, you know, I've worked with them very closely, and you know, we're busy when I'm on call or so during the daytime. So I've been pretty happy with them. No major issues. I think, you know, every hospital has issues with it when you look at it overall. But you know, I've been pretty pleased with most of the anesthesiologists that work here at the hospital so far.
I'm Russell Downey, MD. I am a surgeon working out at Kaweah Delta Medical Center in Visalia, California. Since the entire time I have been here in Visalia, I have worked out of Kaweah Delta, originally Kaweah Delta District Hospital. During that time, of course, we have seen different anesthesia groups come and go, but the current group has been with us for quite some time, I believe well over 10 years. Every Wednesday I have block time at Kaweah Delta, and the operating room there is staffed by the anesthesia group that has been with us for quite some time. They are responsible for keeping the patients comfortable during surgery, either by putting them completely to sleep with a general anesthetic or by giving them sedatives and monitoring the vital functions while we are operating on the patient, either with them fully asleep or with them sedated and using a local anesthetic. We have a great anesthesia group. One of the great things about working out of Kaweah Delta Medical Center is our anesthesiologist. I, of course, have been here for many years, but prior to coming to Visalia, I worked with many different anesthesia groups out of many different hospitals, and sometimes it can be a little bit scary. When you're operating on a patient, you're concentrating on doing what you need to do to complete their operation and do it safely, and during that time, you need to be able to concentrate on your job and not be worried about the safety of your patients and the competence of the anesthesiologist that is responsible for monitoring your patient while they're under anesthetic. This group is uniformly an excellent group. They are all physicians. We do not have any nurse anesthetists, so consequently there's never a situation where somebody has to be called into a room. We already have the person there and present during the case already. The other thing I like about the group is there are times, particularly when you're dealing with severely injured or very sick patients, where the anesthesiologist needs help. And not only is the anesthesiologist in the room, but many times with difficult cases, a second anesthesiologist has come in to help and are usually readily available.
My name is Parley Madsen. I'm a neurological surgeon. Since I came to this area about nearly 7 years ago.
What services have they provided for you?
They provide primarily inpatient anesthesia for patients that are undergoing neurological surgery procedures, principally spine. I think that the anesthesia service here is more than adequate. In fact, they have gone out of their way to provide special services that are required with some of my more complex patients.
My name is Dr. Frederick W. Mayer. I'm the Director of Cardiac Surgery at Kaweah Delta Healthcare District for the Cardiac Surgery Program. I started a program 16 years ago, and VAMA has been the anesthesia group for that entire 16 years. They've provided us world-class anesthesia. We have a very active cardiac program. I've had excellent anesthesia support, implementation of the protocols which are required with our cardiac surgery, excellent post-operative courses in terms of getting patients extubated, and excellent anesthesia and excellent coverage for any emergencies or occurrences that may require the coverage for urgent cases or emergency cases.
What are your general feelings about the quality of their work?
I've been very pleased with it. I've been in a number of programs before I came here, a number of institutions, and I can honestly say that I haven't been anywhere that anesthesia coverage and performance has been better.
Hi there, this is Vinod Gupta. I'm the director of the cardiac cath lab. I just have to say that they are the best in the business, and I haven't had any complaints about them from their availability or their performance. Not only that they provide the best anesthesia, but they are very helpful in the cath lab also. When I have a patient with acute angioplasty, cardiac arrest, intubated, they are there to manage the drips or whatever it needs to be done. And from my standpoint of view, I do not think any other group can match their performance. And I don't even need the improvement from them because I think that they are the best right now. And we don't want to be complacent, they can still improve, but they are the best right now. And the other thing is that they not only provide cardiac anesthesia, but they are also involved in the betterment of the whole cardiac surgery program. Any problems comes in, Byron Mendenhall involved himself in and see what the problems are and how they can help to improve the outcome in our cardiac surgery program. So I strongly recommend, without any reservation, that we shouldn't even look at any other group. This is the group, this is what we want, and this is the cardiologist. I'm speaking on the behalf of the cardiologist. This is what we want. We want to keep the program stable and the way it is, and it is working very right. Don't stir it up, and it's going to get worse, not better. Thank you.
Oh, you're still there. So there you have it. You don't have to take my word. Listen to the customers. These are the surgeons at Kaweah Delta Hospital. VAMA, 16 years strong. Whether volunteering in such hospital projects such as Doc Shop, whether doing CMEs, as I just did one on malignant hypothermia, whether giving our opinion in the What's Up Doc news forum, or whether volunteering or giving donations for such projects as Da Vinci or our newest Kaweah wing. We are part of Visalia. We live here, we work here, our families go to school here, we worship here. We're part of the community, and we like to continue being part of this community. Guys, I have a case to do. I'll talk to you later. Bye-bye.